Hey everybody, welcome to Drug Talk. My name is Garrett Campbell. In today's video, we're going to be discussing 5 facts about Lamotrigine, and we're starting right now. Fact number 1. There exists a black box warning for Lamotrigine. So cases of life-threatening serious rash, including Stevens-Johnson syndrome and toxic epidermal necrolysis, or rash-related death, have been caused by Lamotrigine. The rate of serious rash is greater in pediatric patients than in adults. And additional factors that may increase the risk of rash include co-administration with valproate, exceeding recommended initial dose, or exceeding recommended dose escalation for Lamotrigine. It is not possible to predict which rash will prove to be serious or life-threatening. Fact number 2. What is the dosing in bipolar I disorder? So patients not taking an enzyme-inducing drugs or valproic acid would use 25 milligrams per day orally for 2 weeks, then 50 milligrams per day for 2 weeks, then 100 milligrams per day for 1 week, then maintain at 200 milligrams per day, and they would periodically reassess the need for continued use past 16 weeks of therapy. For patients using this medication added to valproic acid, they would use 25 milligrams per day orally every other day for 2 weeks, then 25 milligrams per day for 2 weeks, then 50 milligrams per day for 1 week, then maintain at 100 milligrams per day, again periodically reassessing the need for continued use past 16 weeks. Fact number 3. What are some common uses of Lamotrigine? Well, we may see this medication used in the treatment of bipolar I disorder, Lennox-Gastaut syndrome as an adjunct therapy. It can be used as an adjunct or monotherapy in partial seizure. As well, it can be used as an adjunct therapy or add-on therapy in primary generalized tonic-clonic seizures. Fact number 4. What are some precautions of this medication? So there's an increased risk of suicidality, so monitoring of this would be recommended when patients use Lamotrigine. And there's a possible increased risk of worsening depression or suicidality in patients with bipolar disorder, regardless of whether or not they're receiving treatment. Fact number 5. What are the pharmacokinetics of Lamotrigine? So in terms of excretion, we would see 2% fecal and 94% renal or kidney. We would see a Tmax, which is the time it takes to get to maximum concentration, at 1.6 to 5.2 hours. This would be less in pediatric patients. And for a half-life, in healthy adults, we may see 25.4 to 70.3 hours. In the elderly population, we may see 31.2 hours. And if a patient has hepatic or liver impairment, we may see 46 to 100 hours. Alright everybody, that's it for today. 5 facts about Lamotrigine. Be sure to subscribe and like the video on the way out.